name's Joyce Gibb. Thank you so much for being here with me today. And I wanted to go over a couple emails. So the first email is from Linda, and she talks about her daughter has been diagnosed with asthma brought on by severe allergies and being a runner. So allergies can contribute to asthma, and then exercise-induced asthma can come from being a runner. The medication they have prescribed gave her severe anxiety attacks. Therefore, the asthma is not being properly treated and is getting worse. Are there any alternative or holistic ways to treat asthma? So when you look at asthma, you can have the allergic component of that, and that causes an inflammatory response, almost like cytokines that in your system, in your lungs, cause asthma. So trying to keep her from having, treating allergies is one way to do that. The second one is, it sounds like she has exercise-induced asthma. And a lot of people with exercise-induced asthma are deficient in magnesium. So magnesium is a smooth muscle relaxer. So you could use one of our products. It's called magnesium, the professional magnesium through the essential line. And you dose that to bowel tolerance. And that means if you take magnesium, you get too much magnesium, it'll cause loose stools. So you back off on that. How else does this tie into your digestive system? When you're running, your diaphragm goes up and down, up and down. And, when you're heavily, basically, when you're running, and some of the food, if it's still in your stomach and it's not broken down, it actually the gases can come up past your epiglottis, and it can cause a spasm, and you can have asthma from that. So one of the ways that I treat this is make sure you have plenty of digestive enzymes to break your food down. Don't run on a full stomach, all those like commonsensical type of things. So a lot of people, though, when you look at asthma and you want to run, a lot of people want to lower their cholesterol, and exercise is also a way to lower your cholesterol. And I'd like to tie in another email, which is from Dave. And he says, I'm looking for safe yet effective solutions to my cholesterol problem. Currently, total number is around 260, which is high for a total cholesterol, and my LDL level isn't where it should be. About 25 years ago, I was put on Lipitor, but that jacked my liver enzymes. About a year ago, my doctor tried Crestor, but I developed a rare side effect of darkened urine, which is, breakdown of your muscle tissue, basically, through your liver. Next, the doctor tried a non-statin alternative, but that also produced the same side effect as the Crestor. Now, I didn't say exactly what that was. Both times, the problem disappeared quickly when I stopped the medication. Now he's prescribed Pravastatin, but I'm leery of that drug since it also can produce darkened urine. I eat mostly a vegetarian diet and recently lost 29 pounds. So that's also really good. On ideal protein, so he's on a keto diet. I also walk around 9,000 steps a day. What would you suggest that would make my liver's life much easier? Now remember, cholesterol is synthesized in the liver. So a couple things that we can do to help the liver. Number one is bergamot. That actually helps break the cholesterol down. It's 500 milligrams. You can take one of those 3 times a day. That's one of our products, the essential line. And bergamot is BERGAMOT, 500 milligrams 3 times a day. Choline citrate actually helps the liver process the cholesterol, and it's 1 teaspoon a day, and you put it in some juice. It's not the best tasting thing, but that will actually help decrease your liver enzymes, especially if you have fatty liver. And the last thing that I would recommend is not our product, but is something that we can help you get, to take. And it's something called TUDCA Advanced. And it increases bile acid production, which downstream helps produce more your liver. So when somebody has high cholesterol, it's really tied to your gallbladder and your liver. So you have to make sure that you eat well like he is. It sounds like he's doing a great job with eating live whole foods, which is the best thing you can do. And that produces a lot of good bacteria that can help produce, these toxins that are broken down in your liver. And I also like to just recommend that you listen to the series on detoxification that I've done. There's like 5 or so videos on how to detoxify your body, which needs to be done every minute of every day, not 1 week, not 2 weeks, every so often. So your liver is the detoxifying agent. So, for him, I'd say, if he hasn't tried Zetia, that would be another pharmaceutical drug, and maybe that was the non-statin that he was talking about, and it's just once a day. So that could also help with this, but I would focus on his liver and his gallbladder and trying to get more liver gallbladder flow and making sure that he has good bowel movements every day, because upstream from your colon is your liver gallbladder. So you have to empty the processes below to get your gallbladder and liver to function well. So if you have any questions about this, I frequently talk to people all the time about their health problems, their cholesterol, and many other things. So let me know, and I'd love to help you on your journey to good health. And just give me a call. Thanks a lot. Thanks for listening. If you want to make sure you're getting the latest health information, click the subscribe button below and ring the bell. That way you can make sure you're not going to miss out on any of the latest information.